Uh, uh, uh. Take.
It's not good for you either.
Hello. Alright, now I'm going to be palpating the subscapularis, and I'm going to ask my patient to hold her arm this way. Boom. Subscapularis is in here and under the scapula and the subscapularis fossa, and its distal attachment is the lesser tubercle. And we're going to do the supraspinatus, which is in the supraspinatus fossa, and its distal attachment is the greater greater tubercle of the humerus, and the infraspinatus, which is in the infraspinatus fossa, and is also attached to the greater tubercle. And we have the trapezoids, which come all the way here, and trapezius, and wrapped here. So it's like a big triangle. And its proximal attachment is the external occipital tubercle up here. So it attaches to your occipital bone of your skull. And then its distal attachment is the lateral clavicle right here, and the scapular spine, which is here. Alright, so now we're going to be palpating the rhomboids, and its proximal attachment is the spinous process, which is the little pointy parts of your vertebrae, and the distal attachment is the medial border of the scapula and the inferior angle. Now we're going to do the serratus anterior, which its proximal attachment is the external surface of the 9 ribs, which is here, and its distal attachment is the anterior surface of the medial border, which is here. And then for the levator scapula, its proximal attachment is the transversal processes of the first cervical vertebrae, so the little pointy parts off the vertebrae. And then its distal attachment is the medial border of the scapula, right here, and an inferior angle of the scapula spine. Alrighty. So now we're going to palpate the teres major, which attaches to the inferior angle and the lateral border, so that's over here. And its distal attachment is the lesser tubercle of the humerus. So it's like in this general area. Now we're going to go to the teres minor, which is also on the lateral border of the scapula, and its incision is the greater tubercle of the humerus. Probably there. All right. So we're going to palpate the pectoris minor, which is on the 3rd and 4th and 5th ribs, and its distal attachment is the medial surface of the core process, which is here. And then pectoris major, its proximal incision is the medial half of the clavicle, which is right here in the sternum. And then the distal incision is the crest of the greater tubercle. So now we're going to palpate the bicep brachii, and its proximal incision is the core process, which is here, and its distal incision is the tuberosity of the radius. And then for the coracoid brachialis, the proximal incision is also the core process, and the distal incision is the medial surface of the mid-humerus, which is there. Okay, so now I'm gonna do a manual muscle test on the upper traps. So I'm gonna ask my patient to shrug her shoulders and then put your ear to your shoulder too. And I'm gonna ask you to hold this position for 5 seconds. Don't let me break you out. Ready, go. 1, 2, 3, 4, 5. All right, relax.
This is okay.
Yeah, and then I'm gonna do a bicep manual muscle test.
Can we start all over? Because I can take this off.
No, it's fine.
Oh, we'll still start all over because I'm gonna take my glasses off.
Okay. All right, so now I'm gonna do a manual muscle test on the upper traps, and I'm gonna ask my patient to raise her shoulders, and then put her ear to her shoulder, and hold this position for 5 seconds. Ready, go. 1, 2, 3, 4, 5. Relax. And then we're gonna do bicep. So I'm gonna ask her to flex her arm like this and hold this position right here. And I'm gonna try and break you out. Ready, go. 1, 2, 3, 4, 5. And relax. And then I'm gonna raise her arm and put it right here. And I'm gonna ask her to hold this position as we test the brachialis. And I'm gonna ask you to hold this position right here. Ready, go. 1, 2, 3, 4, 5. And then we're gonna go to the posterior deltoid. And we're gonna hit this position right here. And I'm gonna ask you to hold this right here. Ready, go. 1, 2, 3, 4, 5. And then we're gonna do middle deltoid here. Hold this position for me right here. Ready, go. 1, 2, 3, 4, 5. And then we're gonna go to anterior deltoid and hold this position right here. Ready, go. 1, 2, 3, 4, 5. Relax. Okay, that's fine. Okay, now I'm gonna be testing serous anterior, and I'm gonna ask you to make a fist and go like this, and I'm gonna try and push you out. Ready, go. 1, 2, 3, 4, 5. Relax. And then I'm gonna ask you to levitate your arms. Yeah, like that. Okay. And I'm gonna try and push you out, and we're testing pectoris major. Ready, go. 1, 2, 3, 4, 5. Relax. Okay. So now I'm gonna do rhomboids and levator scapula, and I'm gonna put you in a position like this. And I'm gonna ask you to hold this position right here, and I'm gonna try and pull you out. Ready, go. 1, 2, 3, 4, 5. Relax.
Yeah.
And then I'm gonna do lats. You're gonna hold this position right here, and then I'm gonna try and push you out. Ready, go. 1, 2, 3, 4, 5. All right. So now I'll be testing middle traps. And I'm gonna ask him to put his arm in this position and hold it like this. And I'm gonna try and push you out. Ready, go. 1, 2, 3, 4, 5. And then I'm gonna test lower traps. And I'm gonna ask you to hold your hand like this. And hold this position. Don't let me push you out. Ready, go. 1, 2, 3, 4, 5. Relax. And then I'm gonna do teres major, and I'm gonna put your arm in this position and hold it just like this. Like you gotta hold it right here. All right. Ready?
Alright, you're not feeling.
And I'm gonna try and push you out. Ready, go. 1,
water just
2,
running?
3, 4, 5.